musango guno ng'amaze okumubuuza ebibuuzo ebyo bye bababuuza yamugamba bino. Yamugamba nti yali tafunangako okunyiiga okusukkiridde era nti teyafunangako okubeerawo nga takyayagala kwetaba mu bintu ebyessanyu, nti era yali talina okubeerawo ng'awulira atidde nnyo oba yeeraliikiridde nnyo, nti era teyalina ekiraga nti yali asanyuka nnyo oba okubeerawo ng'ayagala kukola ebintu ebisukkiridde.
My Lord, he also told me that he has no history of using illicit drugs like cannabis. However, he occasionally used alcohol. My Lord, that helps me to elicit if someone has a substance use disorder.
Yes.
He also told me that he has no history of having had any traumatic experience in his life. That is a question that can help me elicit if someone has what we call PTSD.
If somebody has,
PTSD.
which is?
It's post-traumatic stress disorder. My Lord, the client told me that I was the first mental health personnel he has ever seen in his life.
Agambye nti ebibuuzo bye babuuza abalwadde abajja mu ddwaliro yaabwe bya nkizo nnyo okusobola okutegeera bulwadde ki bw'omuntu bw'alina ku bwongo bwe. Okugezesa bw'abuuza nti wali obaddeko awo n'owulira ng'onakuwadde nnyo n'owulira nga tokyayagala kwetaba mu bintu ebyessanyu, aba agezaako okulaba omuntu oba alina obulwadde bwa depression oba okubeera ng'omuntu munakuwavu buli kaseera. Bw'abuuza nti oba omuntu abeeraawo n'awulira ng'atidde nnyo oba yeeraliikiridde nnyo, aba ayagala kulaba oba alina obulwadde obw'okweraliikirira nnyo oba anxiety disorders. Nti era bw'abuuza oba omuntu abadde nga abaawo n'abeera nga musanyufu nnyo oba n'ayagala kukola ebintu ebisukkiridde, aba ayagala kulaba oba omuntu oyo alina obulwadde obunene obukosa obwongo ate nga bwo bulwawo okuwona obwe bayita bipolar affective disorder. Era yamugamba nti yali talaba bintu oba kuwulira ebintu abalala bye batawulira, n'agamba era yali takozesa biragalalagala ng'enjaga oba ebirala. Naye n'agamba nti obw'olumu yali anywa ku mwenge, nti okulaba nti oba era ebyo byonna bimubuuza okulaba oba yali alina obuzibu nga buva mu kukozesa ebiragalagala. Nti era yamugamba nti yali tafunangako okuyisibwa bubi oba trauma, era bw'aba amubuuza ebyo aba ayagala kulaba oba yali afunnyeko okuyisibwa bubi ate ne kimukosa kye bayita post-traumatic stress disorder. Nti era yamugamba nti gwali mulundi gwe gwali gusookera ddala okulaba omusawo w'obwongo mu bulamu bwe, era n'agamba nti tanywangako eddagala erikwata ku bulwadde bwonna obw'obwongo, naye n'amugamba nti yali alina obulwadde bwa nalubiri oba sikosel, nti ate yali ali ku ddagala ly'obulwadde obwo. Era yamugamba nti waka yewakusatu mu baana abana, nti abazadde be bakyaliwo ate bali bulungi, nti ate mu kika kyonna talinayo gw'amanyi nga alina obulwadde bw'obwongo.
My Lord, for my mental state examination as a professional, I will be able to conclude whether someone has a mental illness or not at the time.
Mwami Okello bwe yamukebera yasanga nga yali talina ebimutawaanya mu mutwe ng'okulaba oba okuwulira abantu abalala bye batalaba, nti ate yali ajjukira bulungi ebintu bye yali amanyi, ng'asobola kutunuulira ekintu kimu n'asigala ku kintu kimu nga tawankawanka, nti ate n'okumanya ebintu ebimwetoolodde oba ebigenda mu maaso, n'amanya okwawula ebintu ebyali kumpi naye, nti ate ng'asobola kugattamu n'okwawula nti yali asobola kwogera essaawa zaali mmeka oba mwaka ki gwe tulimu, oba n'okugamba nti nze gundi. Ng'omusawo bw'aba akebera obwongo, kiba kimuyamba okulaba oba okugamba nti omuntu alina obulwadde bw'obwongo oba tabulina ku kaseera ako.
My Lord, basing on the psychiatric interview plus my personal mental state examination, at the time he presented to me, I established that Mr. Oyom Christopher had no established mental disorder.
Nti okusinziira bwe yayogera ne mwami Onyom Christopher, nti ate n'okumukebera kwe yamukolako yakakasa nti mwami Onyom Christopher yali talina bulwadde bwa bwongo bwonna.
I,
Say your names.
Dr. Genda Rogers,
Swear by the Almighty God
swear by the Almighty God
that the evidence I shall give touching the matter now before court
that the evidence I shall give attaching the matter before court
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing else but the truth.
and nothing but the truth.
Doctor, you please repeat your full names.
I am Dr. Rogers Agenda.
May you spell agenda for court?
A-G-E-N-D-A. Yes.
You say you're 41 years.
Yes, my Lord.
Where do you work?
I work with Psychiatric IHK.
You work with?
With Psychiatric IHK, International Hospital, Kampala, my Lord.
Before IHK, what did you say?
I am age 41 years old, my Lord.
The hospital.
I work with Care, Care, International Hospital, Kampala, my Lord.
Who are you at CK International Hospital?
At Care IHK, I am a psychiatrist.
For how long have you worked as such?
I've worked as a psychiatrist for the past 4 years, my Lord.
IHK.
My Lord, same time. 4 years.
Doctor, what are your qualifications?
I am a medical doctor. I have a master's degree of medicine in psychiatry, obtained in 2022
Master.
at Makerere University.
Yeah, we are going to go by pen is speak.
Okay?
Yeah, yes. So you obtained this in which year?
2022.
Other than the masters, do you possess any other qualifications?
I have a bachelor's degree of medicine and surgery from Makerere University, obtained in 2010.
So for how long have you practiced medicine?
I practiced medicine, my Lord, for the past 16 years now.
So, Mwaganya, we can now have interpretation.
Sure, my lord.
Ono omusawo bamuyita Agenda Rogers nga wa myaka 41 egy'obukulu ng'akola n'eddwaliro erya Psychiatric ku International Hospital Kampala ng'ate musawo wa bwongo amaze emyaka 4 ng'ajjanjaba obwongo ate n'okubeera mu ddwaliro erya International Hospital Kampala amaze emyaka 4. Obukugu ayina masters mu by'obusawo eby'okujjanjaba obwongo nga yasomera mu University ya Makerere ate n'amala nga 2022 era yasoma degree esooka mu busawo n'agijja Makerere University nga yamala 2010 ate amaze emyaka 16 ng'akola omulimu gw'obusawo.
Doctor, what are your duties as a psychiatric doctor?
My Lord, as a psychiatric doctor, I receive clients at my mental health clinic at CK IHK. I assess them.
Let's go slowly, doctor.
Okay.
Just imagine we are writing.
Yes, my Lord.
So you receive patients at your mental health clinic
Yes.
at CK.
At CK IHK.
Yes.
I carry out an assessment, a psychiatric assessment on these patients or clients.
Yes.
I diagnose mental disorders, if any. If there is a diagnosis, I go ahead and treat them with medication and therapy.
Yes.
Sometimes I am required on case-by-case basis to write a psychiatric report. Depending on the individual, sometimes can be work-related. Sometimes those reports can be required by court. Sometimes they are required for compensation purposes. That is it, my Lord.
Are you in position to recognize the accused person in
I
the
think
door?
you can remove the mask first and so that yeah.
Yes, my Lord, I recognize him.
You can put on back the mask.
How do you know him?
My Lord, he came one time to CK IHK as one of my clients.
What brought him to CK IHK?
My Lord, he came to CK IHK after having been referred by the Ministry of Internal Affairs. Immigration Department. They had told him to get a sanitary medical report. To help him obtain citizenship in Uganda.
Doctor, is this a general or unique requirement applicable to only the accused?
My Lord, this is a requirement for everyone seeking citizenship in Uganda by the Ministry of Internal Affairs.
Can interpret?
Mirimu gy'akola afuna abantu abajja mu ddwaliro ery'emitwe ku Sikea International Hospital Kampala n'abeekebejja obwongo n'akebera oba balina obulwadde bwonna. Bw'asanga nga balina obulwadde bwonna n'abajjanjaba ng'akozesa eddagala, oluusi ng'akozesa engeri endala y'obujjanjabi. Nti oluusi bamwetaagisa okuwandiika ripooti ng'amaze okukebera obwongo bw'abantu, oluusi nga baagala kubikozesa mu mirimu gy'abantu, oluusi nga kooti yeetaaga ripooti ezo, oluusi nga beetaaga ripooti ezo okuliyirira abantu. N'agamba nti omuvunaanibwa amumanyi nga yagendayo ku ddwaliro erya International Hospital Kampala ng'omu eyali agenzeeyo kumulaba nga ab'ekitongole kya ministry ey'ensonga z'omunda nga bamusindiseeyo okufuna ripooti eraga nti yali omuntu eyali ategeera bulungi ng'omutwe gwe gukola bulungi asobole okufuna obutuuze mu Uganda. Nti kino bulijjo buli muntu ayagala okufuna obutuuze mu Uganda basooka ab'ekitongole ministry ey'ensonga z'omunda esooka kumusindika omusawo okumukebera oba omutwe gwe gukola bulungi oba nedda.
Doctor, did you carry out the sanitary assessment on the accused person?
Yes, my Lord.
And after you carrying out that assessment, did you author a report?
Yes, my Lord.
To whom did you give the report?
My Lord, I gave the scientific medical report to Mr. Oyam Christopher Okello.
And after that event, did anything else occur in respect of your client?
No, my Lord.
Eventually, did anything else occur in respect of the work that you had done on him?
Well, recently, Sikea IHK got a police request basing on one of their exhibits. That was a report written by me. So they wanted the hospital administration to verify that, number one, it was a report written by me. Also to verify that it is their headed paper and it's their stamp.
Yes.
My
followed.
yeah, my lord, when that happened, the hospital administrators reached me. To verify if the said report was actually mine.
What did you verify?
My lord, I verified that the report was actually mine. After that, my lord, the hospital administration, through our CEO, wrote back to police concerning the same.
Why is it the CEO that replied the police request?
My lord, it is a policy of the hospital that any external request should be handled at administration level, not at the doctor's level.
Before your admin sent out the reply, were you required to do anything in respect of the report that you had authored?
My lord, after verifying that was actually my report, I countersigned it.
Are you in position to identify a reply from your facility, the sanitary report that you countersigned, and the police request that you are referring to?
Yes, my lord.
How would you identify?
Okay, that is, he can identify the police request,
Yes, my lord.
the sanitary report, and the reply.
Yes, my lord.
How would you identify the police report?
My lord,
The police request, sorry.
my lord, the police request has their logo on it, headed paper. and they had been signed by Madame Chelimo, if I remember very well.
About your sanitary report?
My sanitary report, I identified it by my signature, a CK IHK stamp, and it being on the CK IHK logo.
And the letter forwarding your sanitary report?
My Lord, this letter too had the CK IHK logo. It had CEO signature, Azasundo is his name, Azasundo. That also been stamped.
CEO is called who?
Azasundu.
Can you help me spell that?
A Z H A R, then Sundo, S U N D double O.
Let's have the interpretation.
Nti yakebera omuvunaanibwa era n'akola report eyo n'agiwa mwami Okello nti oluvannyuma ennaku eziiseeko emabega eddwaliro erya CK IHK International Hospital Kampala yafuna ebbaluwa nga basinzidde ku bizibiti bye baali balina abapoliisi ne abapoliisi baasaba nga bagamba nti okusinziira ku bizibiti bye baali balina waliwo ripooti omusawo ono gye yali awandiise ate nga baagala eddwaliro likakase nti oba ye ripooti eyo omusawo ono gye yali akoze era bakakase oba olupapula lwe baali bawandiiseeko lwali lwa ddwaliro ne sitampu y'eddwaliro. Oluvannyuma abakulu b'eddwaliro bamutuukirira okukakasa oba ripooti eyo yali yiye era n'akakasa nti eyo ripooti ye yagiwandiika. Oluvannyuma abakulira mukulu w'eddwaliro n'awandiikira poliisi ng'abategeeza ku nsonga ezo nti mu ddwaliro eryo bwe baba nga bawandiika omukulu waabwe yawandiika so si dokita. Bwe yamala okukakasa nti ripooti yayiye yasaako omukono gwe nti bwe baba bagimulaze ripooti eyo ne request n'ebbaluwa gye bazaayo ku poliisi asobola kubitegeera. N'agamba ebbaluwa yali esaba okukakasa yaliko akabonero ka poliisi ng'eri ku lupapula abapoliisi gwe bawandiikako ebbaluwa zaabwe nti ate omupoliisi gwe bayita Madamu Chelimo eyali agisayininze. Ripooti ye asobola kulabako omukono gwe n'alaba stamp ya CK International Hospital Kampala n'alabako n'akabonero ka CK International Hospital Kampala. Ku bbaluwa eyali gye baali baddamu abapoliisi era agamba nti bw'agiraba agijjukirira ku kabonero aka CK International Hospital Kampala nti ate ne siginicha ya mukama waabwe gwe bayita Azasundu.
Please look at the document and tell court if you are in position to recognize it.
My Lord, I recognize the documents.
What are they?
Among the documents, my lord,
Okay, you can begin by the first one, the
the
second,
first
and the third. The first one, what is the first one?
yeah, the first one is a reply from IHK. By our CEO, Mr. Azasundu. It was for the response to the
Dated?
request for the
Dated?
information. Yeah, it was dated the 10th April 2026.
What was the subject?
The subject was a response to requests for information Vide Gaba.
Gaba, does it quote the police reference?
My lord, yes. Should I read out the response?
Yes.
Okay.
CRB what?
The CRB 026 stroke 2026 in brackets ref CID stroke C40 stroke 207 volume 44.
In short, what was your CEO forwarding?
My lord, my CEO confirmed that the sanitary medical report that had been dated 30th December 2025 in respect to Mr. Oyum Christopher Okello was duly issued by International Hospital Kampala Limited, and also confirmed that was authored and signed by myself, Dr. Genda Rogers, a psychiatrist. In my capacity as their medical practitioner.
Okay, it had been authored and signed by yourself?
Yes. In my capacity as a medical practitioner at the facility. My lord,
Okay. About the second document.
okay. My lord, the second document is my sanitary report I wrote. It was dated 30th December 2025.
And the third document.
My lord, the third document is the police request for information to support investigations at Gaba, CRB 026/2026.
Is it dated?
My Lord, this request was dated the 9th of April 2026.
Tasobola kutegeera ebiwandiiko ebisatu bye bamuwadde. Ekisooka kya mukama we kye yawandiikira abapoliisi ng'addamu okusaba kwabwe. Mukama we bamuyita Mwami Aza Sundu nga yagiwandiika ng'ennaku z'omwezi 10 Ogwokuna 2026 nti ebbaluwa eyo yali eddamu okusaba kw'abapoliisi mu musango ogw'Egaba enamba 26 Kasare 2026. Mukama waabwe yali awandiika kukakasa nti ripooti eyo eddwaliro erya International Hospital Kampala eryali lyagiwandiika nga 3 Ogwekumi 2025 nga baali bakebera bagiwandiikira Okello Christopher nti ate yali akakasa nti omusawo ono ye yagiwandiika n'ateekako omukono gwe ng'omusawo yali akolera ku ddwaliro eryo. Era bagiwandiika nga 3 Omwezi Ogwekumi 2025. Ekiwandiiko ekyokusatu kyekyo poliisi kye yawandiikira eddwaliro nga basaba okufuna nga banoonyereza ku musango ogwagaba enamba 2026 Kasare 2026 nga bagiwandiika nga 9 Ogwokuna 2026.
Yes, Mr. Morgan, proceed.
So, Doctor, let's go to the report that you authored.
Yes, my Lord.
When did you author the report?
My Lord, I wrote the report on the 30th December 2025.
And who was your client?
My Lord, my client was Mr. Oyum Christopher Okello.
What other particulars did you take for Mr. Okello?
My Lord, I noted that Mr. Christopher Okello was a 38-year-old male. He was residing in Bunga. My Lord,
Doctor, where did you get that? What was the source of that personal information that you took about your client?
my Lord, Mr. Yum Christopher came to see me personally, so I took all the information from him alone.
So he say he told you he was a resident of Bunga. What else?
Mr. Yum, my Lord, told me that you were single, not married. He was a Christian by religion. And at that time,
Doctor, we are writing.
Oh, sorry, my lord.
And at that time,
And that time, he had a plan to settle in Uganda and start commercial farming.
yes. What else?
My lord, basing on his formal request of the sanitary report, I carried out a psychiatric interview on him.
Carried out a psychiatric interview. Yes.
I also carried out, after that, a mental state examination.
Agamba ripoota ye yagiwandiika nga 3 mwezi gw'ekumi n'ebiri 2025 ntaate omulwadde we baali bamuyita Christopher Okello Onyum. N'agamba nti omulwadde we yali alina emyaka 38 egy'obukulu nga musajja nga yali abeera Bbunga, nti ebyo omwami Christopher ye yabimugamba era n'amugamba nti yali tali mufumbo nga mugoberezi wa Kristo, nti ate akaseera ako yali ayagala kutandika kubeera mu Uganda nga akola bizinesi y'obulimi oba okulunda, nti era okusinziira nti yali asabye okukola ripooti okulaba nti omutwe gwe gwali guteredde oba gukola bulungi. Yagezaako okwogeramu naye alabe omutwe gwe oba gwali gukola bulungi oba nedda, oluvannyuma n'amukebera okulaba oba obwongo bwe bwali bukola bulungi oba nedda.
Doctor, what does this psychiatric examination entail?
My lord, a psychiatric interview entails asking the client many times open-ended questions. The interview, the interview entails asking various psychiatric conditions, psychiatric questions, sorry, with the aim of...
Doctor, I heard that it entails asking the client many times open-ended questions. That's where I stopped.
Yes, psychiatric questions with the aim of trying to enlist if this client has any mental disorder.
So in this case, what did you do?
My lord, upon asking him those questions, Mr. Yum told me the following. Mr. Yum told me that he has no history of having excessive sadness. He has no history.
Let's go through, doctor, as I advised.
Doctor, is that all that on your report or?
Yes, my Lord.
Okay.
Should I continue, my Lord, with the same? Okay.
Yes.
Yeah.
No history of excessive sadness.
He had no history of loss of interest in pleasurable activities.
Sorry, kindly repeat that. He had no history of having excessive sadness.
Yes, my Lord. He had no history of loss of interest in pleasurable activities.
Yes.
My Lord, he also had no history of excessive fears or excessive worries. He had no history of worries, yes.
I shall be prompting you.
Okay.
No history of excessive fears,
Or worries,
worries.
yes.
Yes.
He had no history of excessive happiness or increase in goal-directed activities. Increase in goal-directed activities.
Nti mu musango guno ng'amaze okumubuuza ebibuuzo ebyo bye bababuuza yamugamba bino. Yamugamba nti yali tafunangako okunyiiga okusukkiridde era nti teyafunangako okubeerawo nga takyayagala kwetaba mu bintu ebyessanyu nti era yali talina okubeerawo ng'awulira atidde nnyo nnyo oba yeeraliikiridde nnyo nti era teyalina ekiraga nti yali asanyuka nnyo 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 oba okubeerawo ng'ayagala kukola ebintu ebisukkiridde.
Doctor, why were these questions important in your professional assessment of your client?
My Lord, these questions help us to establish various mental disorders, if any, in any client that comes before us.
Okay.
Continue. My Lord, he had no history of...
Just a minute. How do they help you? The court would want to know why, for example, you focus on excessive sadness or interest in pleasurable activities or excessive fears and worries or excessive happiness or excessive goal-oriented activities. Why is this particular direction important to you as a profession in determining or detecting mental disorders?
My Lord, these questions are key to or seeing things other people could not see. When I ask that, my Lord, I'm trying to elicit if you have hallucinations,
Okay.
My Lord, he also told me that he has no history of using illicit drugs like cannabis. However, he occasionally used alcohol. My Lord, that helps me to elicit if someone has a substance use disorder.
Yes.
He also told me that he has no history of having had any traumatic experience in his life. That is a question that can help me elicit if someone has what we call PTSD.
If somebody has,
PTSD.
which is?
It's post-traumatic stress disorder.
Proceed.
My Lord, the client told me that I was the first mental health personnel he has ever seen in his life.
What did he say?
He told me that I was the first, this was the first visit to a mental health personnel in his life.
And how did you reflect that in your report?
Pardon?
How did you reflect that in your report?
If I get what you're saying,
Yeah, what did you write? How did you report that information in your report?
this is the index visit to a mental health personnel.
What? Index visit?
Yeah, index visit, the first visit to a mental health personnel, my Lord. And that he had never taken any psychiatric medications.
He had never taken any?
Psychiatric medication, my Lord.
What else?
My Lord, the client disclosed that he was a patient of a chronic medical condition, sickle cell disease, and that he was regularly taking medication for that purpose.
Anything else?
Yes, my Lord, Mr. Yum told me that he was the third born of 4 children, that his parents are alive and they are well. He also told me that there was no history of any mental illness in their family.
Okay. Let's allow interpretation.
Agambye nti ebibuuzo bye babuuza abalwadde abajja mu ddwaliro yaabwe bya nkizo nnyo okusobola okutegeera bulwadde ki bw'omuntu bw'alina ku bwongo bwe. Okugezesa bw'abuuza nti wali obaddeko awo n'owulira ng'onakuwadde nnyo n'owulira nga tokyayagala kwetaba mu bintu ebyessanyu, aba agezaako okulaba omuntu oba alina obulwadde bwa depression oba okubeera ng'omuntu munakuwavu buli kaseera. Bw'abuuza nti oba omuntu abeera awo n'awulira ng'atidde nnyo oba yeeraliikiridde nnyo, aba ayagala kulaba oba alina obulwadde obw'okweraliikirira nnyo oba anxiety disorders. Nti era bw'abuuza oba omuntu abadde nga aba awo n'abeera nga musanyufu nnyo oba n'ayagala kukola ebintu ebisukkiridde, aba ayagala kulaba oba omuntu oyo alina obulwadde obunene obukosa obwongo ate nga bwo bulwawo okuwona, obwe bayita bipolar affective disorder. Era yamugamba nti yali talaba bintu oba kuwulira ebintu abalala bye batawulira, n'agamba era yali takozesa biragalalagala ng'enjaga oba ebirala. Ye n'agamba nti obw'olumu yali anywa ku mwenge, nti okulaba nti oba era ebyo byonna bimubuuza okulaba oba yali alina obuzibu nga buva mu kukozesa ebiragalagala. Nti era yamugamba nti yali tafunangako okuyisibwa bubi oba trauma, era bw'aba amubuuza ebyo aba ayagala kulaba oba yali afunnyeko okuyisibwa bubi ate ne kimukosa, kye bayita post traumatic stress disorder. Nti era yamugamba nti gwali mulundi gwe gwali gusookera ddala okulaba omusawo w'obwongo mu bulamu bwe, era n'agamba nti tanywangako eddagala erikwata ku bulwadde bwonna obw'obwongo, naye n'amugamba nti yali alina obulwadde bwa nalubiri oba sickle, nti ate yali ali ku ddagala ly'obulwadde obwo. Era yamugamba nti waka wa 3 mu baana 4 nti abazadde be bakyaliwo ate bali bulungi, nti ate mu kika kyonna talinayo gw'amanyi nga alina obulwadde bw'obwongo.
So, Doctor, apart from what your client disclosed to you in the interview, did you proceed to carry out your independent mental examination on him?
My Lord, I proceeded to carry out a mental state examination.
Yes.
My Lord, from this examination, I noted that Mr. Oyum Christopher was a middle-aged man. He looked kempt,
Was a
middle-aged man. He was kempt and was well nourished. the situations well around you. Your ability to do basic mathematics.
Ability to do
basic mathematics. And if you are able to tell the time or the year we are in, or even to tell who you are as a person.
Again, doctor, why is this particular assessment in your mental health examination about these aspects of perceptual and cognitive perceptions, or rather disturbances?
My Lord, for my mental state examination, as a professional,
From a mental state
examination, as a professional, I will be able to conclude whether someone has a mental illness or not at the time.
Yes, proceed with your findings.
My Lord,
Maybe before you do, it might be too much for interpretation. Let's allow the interpretation.
Yalaba nga yali ayogera nga bulijjo nga talina buzibu, nti era yalaba nga yali alowooza bulungi nga talina bimutawaanya mu mutwe, era n'agamba nti embeera ze zaali ng'eza bulijjo, nti ate embeera ze nga bwe zaali era bwe wamulabanga n'omanya nti embeera ze ne bwali nga kye kimu, nti era n'akinyonyola n'agamba nti ye ng'omusawo asobola okukulaba n'agamba nti oba oli munakuwavu oba oli musanyufu, nti ate okulaba nti mood oba okulaba embeera z'olimu akwekebeja okumala ekiseera n'amanya nti embeera zo ziri bwe ziti. Nti mwami Okello bwe yamukebera yasanga nga yali talina ebimutawaanya mu mutwe ng'okulaba oba okuwulira abantu abalala bye batalaba, nti ate yali ajjukira bulungi ebintu bye yali amanyi, ng'asobola kutunuulira ekintu kimu n'asigala ku kintu kimu nga tawankawanka, nti ate n'okumanya ebintu ebimwetoolodde oba ebigenda mu maaso, n'amanya okwawula ebintu ebyali kumpi naye, nti ate ng'asobola kugattamu n'okwawula, nti yali asobola kwogera essaawa zaali meka oba mwaka ki gwe tulimu, oba n'okugamba nti nze gundi. Ng'omusawo bw'aba akebera obwongo, kiba kimuyamba okulaba oba okugamba nti omuntu alina obulwadde bw'obwongo oba tabulina ku kaseera ako.
Doctor, proceed.
My Lord, basing on the psychiatric interview, plus my personal mental state examination, at the time he presented to me. I established that Mr. Oyom Christopher had no established mental disorder. My Lord,
First interpret that.
nti okusinziira bwe yayogera ne mwami Onyom Christopher nti ate n'okumukebera kwe yamukolako yakakasa nti mwami Onyom Christopher yali talina bulwadde bwa bwongo bwonna.
Yes.
my Lord, I therefore affirmed that time that Mr. Oyum Christopher was sane and mentally fit to live and work in Uganda.
Did you sign off the report?
Yes, my Lord, I signed the report.
Was it stamped then?
Yes, my Lord.
What was the date of signing or stamping?
My Lord, I signed it on that very day, 30th December 2026.
2020?
2025, sorry. And the stamp was of the same date.
N'olwekyo akakasa nti akaseera ako Onyumu lwe yagendera mu ddwaliro lyabwe yali talina bulwadde bwa bwongo bwonna ate nga tali mulalu era nga yali mulamu bulungi okusobola kukola mu Uganda ate n'okubeeramu n'asayininga n'ateekako sitampu n'ateekako ennaku z'omwezi 3 ogw'Ekumi 2025.
You have earlier told the court that the forwarding letter was authored by your executive director,
Yes, my Lord.
Mr. Azza.
Yes, my Lord.
How did you know it was authored by him?
My Lord, I received a copy of this reply to the police. From the hospital.
Other than the fact of a copy being given to you, what else makes you sure that this letter was issued, rather authored by your executive director?
My Lord, I'm sure because this letter was on CCare headed paper. It was stamped with a CCare stamp and signed by the CEO.
familiar with the signing of your CEO?
My Lord, I'm not familiar with his signature.
My Lord, I pray to tender the report. And together as with the forwarding letter and the request letter, my Lord, the request letter being, we pray that it is admitted as a PID. But the forwarding letter and the report admitted as exhibits.
agambye nti ebbaluwa mukama we gwe bayita mwami Azza ye yagiwandiika era oluvannyuma ne bamuwaako kopi eyo y'ebbaluwa gye baali bawandiikira abapoliisi nga babaddamu era nti mukama waabwe yagiwandiika nga bagiwandiika ku lupapula lw'eddwaliro eryo lya Sikeya ne bateekamu ne sitampu yaabwe oyasayininga ye mukama waabwe. Agamba takakasa mukono gwa mukama we era ne basaba nti ebbaluwa gye omukama we gye yawandiika bagikirize ow'ekitiibwa agirabeko agyekeneenye ripooti n'ebbaluwa gye baawandiika nga basaba nga baddamu poliisi babikirize ng'ebizibiti eby'oludda olwabi.
Who is making a reply? Is it you, Mr. Kumbuga?
My Lord, no objection.
For Mr. Onyum Christopher Okello, dated 30th December 2025 and authored by Dr. Agenda Christopher of CK IHK, is hereby admitted as an exhibit and it is marked PEX 8A. PEX 8A, and the letter authored by Azar Sundu, the CEO of International Hospital, Kampala, trading as C Care IHK, dated 10th April 2026, addressed the Deputy Director of Criminal Investigation, CID Headquarters, confirming the sanity report to have been authored by Dr. Agenda Rogers, who is witness number 12, a psychiatrist at the facility, which attached a certified copy of the sanity report that was dated 30th December 2025, is also admitted, and it is marked as PEX 8B. A police request which was dated 9th April 2026 and authored by SCP Shelimo Biata to the hospital administrator, Care International Hospital, Kampala, is admitted for identification, and it is marked PEID 6.
Kopi gye bakakasa nti eya report gye bakakasa nti omusawo ono ali wano mu Dr. Agenda yagiwandiika nga 3 omwezi gw'Ekumi 2025 bagikiriza ng'ekizibiti ekyomunaana A, era ebbaluwa omukulu w'eddwaliro erya Care International Hospital Kampala gwe bayita Azza Sundu gye yawandiika nga 10 ogwokuna 2026 ng'awandiikira poliisi okukakasa nti ripooti omusawo ono yagiwandiika nayo yo bagikiriza ng'ekizibiti ekyomunaana B. Ebbaluwa poliisi gye yawandiika ng'omupoliisi gwe bayita SCP Cherimo yagiwandiika nga 9 ogwokuna 2026 ng'agiwandiikira eddwaliro okukakasa ripooti Kkooti egyekanyiza era n'egiwa ennamba gye tuyita PEID ey'omukaaga.
My Lord, that's all from the witness.
Mr. Kumbuga, how much time will you take with Dr. Agenda? If you're taking a lot of time, I would have requested that we proposed that we take a short health break, but depends on how much time you want to stay with him. A short health break. Okay. In that case, let's come back at 2 p.m.
Tukomawo ssaawa 8.
Mr. Kumbuga, you're the one cross-examining? Dr. Rogers, that gentleman is going to ask you some questions. Please, you answer them to the best of your knowledge and ability.
Yes, my lord.
Okay.
Sakumga, please proceed.
Doctor,
Yes,
the
my
love,
lord.
the love for justice has brought us here all. And that's the question that this Honorable Court is investigating right now. Help me and answer the following questions.
Yes, my lord.
Okay. Are you aware that the history of illness of the suspect is already on court record?
What is your question?
Are you aware that the question of the mental illness history is already on court record?
Yes, my lord.
Okay. Doctor, the reason why you interacted with the suspect was seeking for citizenship in Uganda. Is that true?
Yes, my lord.
Okay. And this kind of citizenship is based on mental sanity.
Yes, my lord.
Are you aware that your client was denied Ugandan citizenship?
No, my lord.
Okay. In your report, you talked of alcohol, that he was telling you he takes some alcohol. Did you extract any blood samples to know the contents of alcohol in his body?
No, my lord.
Did you also try to investigate by getting blood to know the contents of other substances in his body?
No, my lord.
Apart from him telling you that in his family there is no history of mental illness, did you have any other mechanism to establish whether he was telling you that it was correct?
My lord, We have mechanisms.
But did you do it?
You actually wanted to finish the sentence. I think you were still proceeding. Please continue with your answer.
My Lord, the psychiatric interview and the mental state examination gives us a lot of information to ascertain possibilities of mental illness.
Okay.
Could you please repeat that, doctor? The psychiatric interview and the mental state examination, what do they give you?
My Lord, I'm sorry, I'm competing with the rain. I can't hear properly, my Lord.
Oh,
Yes.
you said that the psychiatric interview and the mental state examination, what do they give you?
The psychiatric interview and the mental state examination are enough to help me ascertain if someone is of a sound mind or not.
Doctor, you have not answered the question.
Yes, my Lord.
Let me put it to you clearly.
Yes.
My question is, did you verify, apart from him, that in his family there is no history of mental illness apart from dealing with him?
No, my Lord.
Doctor, you have talked about questions that you asked him. They are open-ended questions. Will I be right to say that in your report there is nowhere it suggests that you asked him those questions?
My Lord, the report I wrote is to summarize what happened in the interview.
So you confirm to court that those questions are not on your report for court to confirm that actually they happened between you and the suspect?
Pardon, my Lord?
You confirm that those questions you are alleging you asked, they are not on the report, such that court verifies that they actually took place?
Yes, my Lord.
Doctor, will I be right to say that in your report you have no fallback position to verify whether your client, the story was telling you, is right or wrong?
Pardon? Sorry,
Okay, listen carefully.
Yes.
Will I be right to say that in your report you have no fallback position to verify whether your client, whatever he was saying, was not true or not?
Yes, my Lord.
So,
My Lord, the witness is not, because of the noise, the witness says is not fully understanding the questions. We propose that he is allowed to sit by here for him to follow through.
what safeguards did you put there?
My Lord, I would have loved to put some safeguards, but I was just not able to.
So you confirm in your report there are no safeguards?
My Lord,
Doctor, are you understanding the questions? Are you understanding his questions? He's saying that in your reports, there are no safeguards in your report.
in the report.
Yes, to
my Lord.
indicate that for you to be able to know that you were getting accurate information from him.
My Lord, my report has safeguards.
My Lord, I pray you give him his report to read it to court. Doctor, listen. Read to this court that this heading says safeguards against telling lies.
I don't understand that question. I think you're putting a witness in a very tricky position. We all have the report, so I think you can ask a better question that would enable him to answer. Because clearly that information is not on the report.
Much obliged. So can you tell us that this is the safeguard against telling lies to me
My Lord,
in the report?
yes. My Lord, in the mental state examination in my profession, I stated that this person kept eye contact. In my report, I reported that he was calm throughout the interview.
Okay. We go to the next question.
Yes, my Lord.
Would I be right that according to your experience with the people who are applying to citizenship in Uganda, coming for that report, one of the reasons is that those with mental challenges are not granted citizenship?
It is a possibility, my Lord.
Doctor, you told the court that your client had sickle cells.
Yes, my Lord.
And will I be right to say that sickle cell has many underlying, mental illness has many underlying causes?
Yes, my Lord.
What is the question? Before you answer, first understand. What is the question, Mr. Kumbuga?
My Lord, the question is that circumstances, that there are many circumstances leading to mental illness, underlying causes. The question is around there.
Okay, what is the connection between mental illness and sickle cells? That is where I didn't get right.
Okay, my Lord, let me ask. I repeat. Will I be right to say that conditions leading to mental illness in somebody's life are many?
Yes, my Lord.
Okay. In your wisdom and experience of your profession, will I be right to say sickle cell is one of the underlying causes to mental illness?
My Lord, I would call it a risk factor, not a direct cause of mental illness.
So a risk factor is one of the causes to mental illness.
Please don't confuse the witness. The witness said it is a risk factor, but not a direct cause. So don't mix them.
So,
Get lost.
my lord, I just need clarification from him.
Please do.
So, sickle cell is a risk factor leading to mental illness.
Yes, my lord.
So your report is dated 30th December 2025.
Yes, my lord.
Okay. That report as it's dated, can you be able subsequently to determine whether your client was normal?
My lord, this report verified that the client is of the sound mind.
I think his question is that this was as of 30th of December 2025. Would you know his mental health after this date? Is that your question?
Yes, my lord.
My lord, this was one-time contact with this client.
So you confirm you cannot know his mental status after 30th December 2025?
Yes, my lord.
My lord, that's all.
Thank you so much. Mr. Mwaganya, any re-exam?
My lord, no re-exam.
Agambye nti akimanyi nti ebbaluwa ezigera ku bulamu bw'omuvunaanibwa ziri ku fayiro ya kkooti, nti ate omuvunaanibwa yali asaba okubeera omunnayuganda, nti ate ebiseera ebisinga bakukkiriza okubeera omunnayuganda nga bamaze okutegeera oba omutwe gwe gutegeera bulungi oba nedda. Takimanyi oba bamukkiriza oba tebamuwa obutuuze mu Uganda. N'agamba nti yamugamba nti oluusi yali anywako ku mwenge naye teyamuggyako omusaayi okukebera omwenge gwe yali alina mu mubiri gwali gwenkana ki, era agamba nti teyamuggyako omusaayi okumukebera ebintu byonna oba ebitokooza obwongo ebyali mu mubiri gwe. Yamugamba nti yali talina buzibu bwonna n'obwongo bwe era ne mu kika kyabwe bwali teva bulina, nti naye bwamukebera aba asobola kumanya nti oba alina obulwadde bw'obwongo oba nedda, nti teyakakasa oba bali tebalina bulwadde bw'obwongo mu kika kyabwe okuggyako yeeye yamugamba nti mu ebibuuzo bye yamubuuza ng'amukebera teyabiwandiika mu ripooti wabula yawandiika ebyali byetaagisa ng'amaze okwogera naye nti ebibuuzo bulijjo tebabiwandiika mu ripooti nti ate nti mu ripooti tasobola kuteekamu ekiraga nti akakasiza omuclient we kye yamugamba n'agamba nti mu ripooti ye yagamba nti omuntu ono yali asobola kutunulira omuntu n'asigala nga mutunulidde yali mukkakkamu era kisoboka nti omuntu bw'aba asaba obutuuze ng'alina obulwadde bw'obwongo bayinza okugaana okumuwa obutuuze agamba nti yali alina obulwadde bwa nalubiri oba sickle cells nti ate waliwo ebintu bingi ebireetera omuntu okufuna obulwadde bw'obwongo n'agamba nti nalubiri oba sickle cell eyinza okuvaako omuntu okufuna obulwadde bw'obwongo naye si kye kireetera omuntu okufuna obulwadde bw'obwongo awo nti oluvannyuma lw'ebiseera ebingi asobola kufuna obulwadde bw'obwongo agamba nti ripooti eyo yagiwandiika nga 3 mwezi gwa 12 2025 nti ate mu kaseera ako omuntu oyo omutwe gwe gwali gukola bulungi nti naye okuva ebiseera ebyo yali tasobola kugamba nti oba omutwe gwe gwali gukyakola bulungi oba nedda.
Thank you. Doctor, just help me understand something. Help me understand the relationship between sickle cells and mental ill health. What's the relationship?
My Lord, when someone has sickle cell disease, they can get multiple complications. Some of these complications can be a stroke, some strokes, my Lord, can manifest with psychiatric symptoms. My Lord, sometimes the medications they use, the painkillers, especially in high doses, can also lead to manifestations of symptoms of mental illness. My Lord, sometimes because of the chronic pain, they can be distressed by the so much pain. They get into a sense of helplessness. And may consider possibly taking their own lives or develop a depression, for example.
Mr. Okello, after telling you that he was a sickle cell disease patient, do you also observe these kinds of things? The distress, the depression, do you observe them?
Yes, my Lord.
You observe distress.
Kindly, I hope I've gotten your question clear, my Lord.
Okay, you have told us that when somebody when somebody is a sickler or is suffering from sickle cell disease, they can get multiple complications. And
Yes,
one of
ma'am.
the complications is a stroke, some of which manifest with psychiatric symptoms.
Yes, my
Maybe
Lord.
I can ask you one by one. Did you observe anything like a stroke on him?
No, my Lord.
Okay, you also said because of the medications, the painkillers, that they can also manifest symptoms of mental illness. Did you observe that?
No, my Lord.
And then you said because of the chronic pain, they may get distressed and they can run into depression. Did you see depression on him?
No, my Lord.
Okay.
agamba nti omuntu bw'aba alina obulwadde bwa nalubiri oba sickle cell asobola kufuna obuzibu bungi. Ekisooka asobola kufuna stroke oba okugangawala, ate oluusi ayinza okufuna ebiraga nti omutwe gwe gufunye obuzibu, obwongo bufunye obuzibu, nti ate n'oluusi omuntu bw'aba amira eddagala erikendeeza ku bulumi nalyo liyinza okumuleetera obubonero obulaga nti omuntu alina obuzibu n'obwongo bwe. Era olw'okubeera nti aba ayita mu bulumi bungi, kiyinza okumuviirako okwekyawa n'okwagala kweja mu bulamu bw'ensi. Naye nti bwe yamukebera ng'amaze okwogera naye, bino byonna talina kye yamulabako.
Mr. Kumbuga, anything that arises from my questioning, please ask.
Since he's a known sickle cell patient, after your examination, isn't it true that these conditions you have named, stroke, depression, can manifest?
My Lord, the fact that he's still alive, they can manifest at any time of his life.
Sister Muwagonya, any questions from my questioning?
Agamba nti ekiseera ekyo we yamukeberera obubonero buno yali tabulina, naye engeri gy'akyali omulamu obubonero buno buyinza okulabika essaawa yonna.
Doctor, thank you so much. Thank you so much for coming.
Welcome.
You can step down. Prosecution, are we still in a position to proceed? Can we still hear each other?
My Lord, not accurately. We, and the next witness, we also require to set up the screen. We are going to be dealing with the CCTV. My Lord, I propose a short break for the rain to settle down a bit.
But we do not know when it's going to do that. And it is now 3 p.m. The whole team has been working hard the whole of this week. I am adjourning this case to Monday, 20th of April at 9 a.m. for further hearing of the prosecution's case, and the accused person is further remanded till Monday, the 20th of April at 9 a.m. Prosecution, bring your witnesses on that day. We should try to start early.
Omuwaabi wa gavumenti agambye nti baagala kulaba obujulizi obuli ku TV n'olwekyo ate enkuba ng'ekyatonya ate nyingi n'olwekyo omulamuzi agamba tujja kuddamu balaza nga 2 Ogwokuna 2026 ssaawa 3 ez'okumakya.
I want to thank you all for being cooperative and for all your work. Have a good weekend.
Abeebaza mwenna olw'okubeera nga mukwataganye naffe bulungi ate abaagaliza weekend ennungi.